You know, for many with diabetes, this little bottle is what they need to stay alive. It's insulin. It's a hormone that needs to be replaced when the body simply can't make any more of it. When someone suffering from diabetes controls the disease, they can avoid some of the complications and other conditions that can come along with diabetes.
But sometimes this just isn't taken seriously. That's why PRMC is getting the word out for Diabetes Awareness Month. Please welcome Kelly Birch, who is a nurse, an RN, and a certified diabetes educator, and she also has type 1 diabetes. So you know what you're talking about.
Most of the time.
Most of the time,
yeah.
Well, first of all, I think whenever we talk about diabetes, we need to talk about the two types and know the difference, type 1 and type 2. What are they?
Right. Type 1 is an autoimmune disorder, so disease. So basically what happened with people with type 1, they say our pancreas was attacked by our own immune system. So it attacked our beta cells. So we no longer make insulin. So that's kind of where type 1 is. Whereas type 2, it can be prevented. There are a lot of risk factors, you know, being over the age of 40, which nobody here is, I know.
No, none of us.
Being overweight, having a family history of diabetes, let's see, high blood pressure, high cholesterol, being inactive, you know, being sedentary. So a lot of, you know.
In your experience, do you think there's a lot of people that don't realize that they have diabetes?
Oh yeah, well right now they're saying 30 million people are diagnosed with diabetes and about 7 million don't know they have it and they're walking around with it. And the best part, not really, 84 million have pre-diabetes in the United States. That's a lot of people.
Wow. It is a lot of people.
So if we can start, you know, getting there and working on prevention, we could be doing a lot of good for
All right, so let's talk about that. What are maybe some of the signs that you're either in pre-diabetes or have diabetes?
Well, the pre-diabetes, it's odd because years ago, you know, I don't know if you guys remember, people would say, you have a touch of sugar or, you know, things like that. Well, the only way really to know about pre-diabetes is lab work. You know, doing an A1C, getting that, you know, getting a report 5.7 to 6.4 is a pre-diabetes A1C level. And then blood work, if you have fasting, what is it, 70 to 99, that's normal, but once you hit 100 fasting, you're at that pre-diabetes level. 100 to 125, at 126 it's diabetes. So there's a little window there that can tell you when you have pre-diabetes. If you're, you know, diagnosed with diabetes, again, it's A1C 6.5 and above, 2 blood glucose levels or fasting 126 or above. But signs and symptoms, there are a lot of people that don't go to the doctor. You know, we aren't always out there and we're not in tune. So the biggest things are, the red flags are excessive thirst, excessive urination, dry itchy skin, blurred vision, infections, and those things heal slower. So there's a lot, I mean, it's...
Have it checked.
Yeah.
So one thing that we're fortunate about is we do have PRMC, and PRMC offers a lot of resources.
We do. I love working there. I love my job. You just don't know. As a person with type 1 diabetes, I think everybody should live healthy with diabetes. It shouldn't just be, you know, the people, we just need to get the word out there, and it's really hard to get patients or people with diabetes to come to classes and to come to events that we have.
Right. So to get the word out, you have a free diabetes event.
We do. Peninsula, we've been doing this for a long while. In November is Diabetes Awareness Month, so Dr. Snitzer, our guru, you know, for diabetes, everybody, I think he's like a superstar of diabetes in the diabetes community. He does a talk, and we discuss, you know, he discusses what the problems may or may not be. So we also have an exhibitor fair, you know, before that. We're going to offer blood pressures, flu shots, free flu shots. We're going to have some of the vendors that make insulin pumps and things like that, so people get to see what's out there because, you know, they don't always get a chance.
All right, let's go over the event details. It is November 11th. That's a Monday from 5:30 to 8:30 p.m. at PRMC's Hollowell Conference Center. And the best part, it is free, so you have no excuse not to be there.
It is. It's free. It's amazing. And we also offer so many other things. We have normal support groups monthly. The second Monday of every month from 6 to 7 p.m. in the Avery Hall Education Building. We have
all kinds of things that you're
and
going
those
to
are
share
free
with us
also.
at this event.
I know, you just don't know. There's
Kelly,
too
thank
much
you
going
so
on.
much.
Thank
you
you
for
so
coming
much.
in.
Look, I want to plug everything.
I know
you don't
you
understand.
do. And we only have an hour
people
in the
to
show.
know.
We only have an hour.
It's not fair.
Thank you,
Diabetes needs
Kelly.
more.
Okay.